So good morning, everybody. And today makes 403 days since our first COVID-19 case, week 58, and it's hard to believe that we're still in this world. But unfortunately, we had a woman in her 40s last night pass away from COVID-19. And we also reported two other people that passed away, a man in his 60s and a woman in her 70s over the weekend, which brings us up to 372 people that passed from COVID-19 since this began. And my heart and prayers go out to the families, to every family that loses someone. It's difficult times to go through, and it doesn't make it easy when you lose a loved one, especially someone in their 40s. It's definitely alarming, the uptick in deaths. We haven't seen this in a long time, and hopefully it's not going to be the trend going forward. So, I actually had a conversation, met with Dr. Venditti today, but I'll get into that in a little bit. But COVID-19's here. It hasn't gone away. So we have to continue to stay vigilant. We have to continue to wear a mask, cough into our arms, clean our hands, and stay 6 feet apart to get through this. Yesterday, we had 48.9% of Albany County residents have received the first dose. 34.7% have received the second, so which is all good. We're going in the right direction, but as we continue, and I have a guest here, I'm talking in a few minutes, Steve Newhouse from Orange County, who we got a great partnership with, and to talk about everything and the efforts we've been doing working together. Those numbers jumped from 47.3% and 33% reported on Friday. Slightly went up. I was hoping to be a little bit higher with all the vaccine out there. One of the things that Dr. Well and I have continued to talk about is, we had the demand, we didn't have the supply. Now we have the supply. We need to continue with the demand to get people in here. But compared to a statewide rate, that's 41.4% have fully vaccinated to 28.1%. So that's the statewide average. So again, we're still ahead of the curve. I think we're ahead of Orange County too, right? Vaccinations.
What are your percentage?
40,
I think you are.
48, 40%.
I'm in the 30s.
I know we are. That's why it was a loaded question.
That's because you're friendlier with the governor than I am.
It would be nicer.
I'm kidding.
Today, Albany County has administered or reallocated 52,000 first and second doses of COVID vaccine. And we've partnered. And one of the things we realized, and my office working with Dr. Whalen and Deputy Dan Lynch and all of us working together, is a partnership is how we're going to get through this, getting everyone involved, getting as many stakeholders as we can in the communities to get the vaccine out. And like I said before, the bigger pods work for certain people. The little pods seem to be working the best, but the logistics and getting the medical corps and volunteers and everyone else is a little bit harder. But it seems to work people like that for walking into their church or wherever it may be. We partnered with South Colony High School. I went there on Saturday. 210 students and administrators went through. We also did nearly 700 doses at the Arbor Hill branch. So that was another huge success. I know it was a little hiccup in the beginning with the computer systems, getting them up rolling. So it was a little bit longer in the first hour or two, and then it picked up and they got it done. So again, great partnership. We also did our second doses at the Capital District Latinos with the help of Dr. Whalen and especially Assembly Member John McDonald to ensure we continue our efforts to vaccinate and do it with equity. And to John and to everyone there involved, thank you so much. It makes a difference. We have to encourage people to get this vaccine. And like I said, partnerships will get it done. Partnerships will make it happen in your community. We also reallocated another 138 shots to Colony EMS. So thank you. And then our next first dose clinic at the Times Union Center will be this Thursday, April the 22nd, and we'll be posting the link up soon. Again, please, people, pre-register. It's been so useful. Steve and I can talk about this a little bit, and obviously Dr. Well and I have from different county point of views that it's been tough. People are still struggling with the state's website, still struggling to figure out. You still got to navigate it. Our pre-registration works. Is it perfect? No, but we can get to you. And the great thing today is across the nation, I believe, everyone 16 and up can get the shot. So there should be no hesitation anywhere in the state of New York or anywhere in the nation. So please, again, I know that changes. Go to our website, albanycounty.com. And I believe Dr. Wellen talked about how much vaccine we got in this week. So again, thank you to her and her team and everything, doing everything. Yesterday, Dr. Fauci said that the pause on J&J will likely end this Friday. Look, it hurt. It hurt the efforts that Dr. Whalen and her team's been doing, we've been doing with our PSA commercials, what you've been doing. It was a major setback with the J&J, but people have to remember 6.8 million people got the J&J, and you had a small percentage of under 6 people with the blood clots. And I'm not a doctor, so Dr. Whalen can answer that. And but I've talked to people. It was a lot to hold that. So the fact that this is going to be coming back out, hopefully on Friday, it means going to be more vaccines the following week. But I'm saying to the viewers, though, and the listeners, please don't wait for that. If you're in line to get one of the other vaccines, keep your appointments. Don't switch it with the hope with J&J coming out next week. So please. As of today, we had 23,407 cases of COVID-19 in our county to date. We've had an increase of 42 positive cases since yesterday. The day before that, we were a little alarmed over the weekend watching number 70 new cases the day before that and 81 the day before that. 81 new positive is the highest number we've had since April 1st. And our 5-day average has obviously went up 64.8%. Yesterday it was 64.6%. Our county 7-day average is now 2.9%. Remember what happened when we started, that number gets up too high. People, please, the light's at the end of the tunnel. We're almost there. We're walking. We're not running yet. We're walking. So please continue to know COVID-19's out there. It was 2.4% at my briefing on Friday. So that number is continuing to go up. Our Capital District 7-day average is 2.3, and there are now 531 active cases of COVID-19. Currently 1,029 people under mandatory quarantine. Yesterday it was 1,048. And out of the new positive cases, 13 had close contact to positive cases. None are healthcare workers. 3 reported traveling out of state. 26 don't have a clear source of infection. As of today, 22,876 people have tested positive for the virus and have recovered, which is good. 62 new recoveries since yesterday. Here's some of the alarming stuff, which, there's 3 new hospitalizations overnight. We now have 30 people currently in our hospital from the virus. Yesterday, that number was 29. And we have 9 people in the ICU. Yesterday, there were 7, and which is up from 6 the day before, which we're starting to see. And we need to watch these numbers. And again, I'm not here to scare people. We are so close, and this is why Steve and I were talking last night over dinner, and again, why he's here to talk a little about what's going on in Orange County. But I had a nice conversation with Dr. Venditti this morning, and they're worried. They said it's probably going to be a little spike. We're going to see a spike. It'll probably go up for 6 weeks, come back down by June. And we're seeing, again, someone in their 40s passed away from COVID-19. There is a very young child in the hospital right now that has COVID-19. We're seeing them numbers start to tick up, and that's when, the hospitals start to pay, they're always paying attention, but they start to get alarmed when they start to see this. So this is something that's real. I know the weather's getting nicer. I know people want to get outside, but again, COVID-19's not done with us. So, we need to continue to stay vigilant, and we need to continue to stay strong to get through this. Social distancing and everything else, bars and restaurants open to midnight start. I think it was today, right? Yeah, this is today. Yeah. They open up to midnight, and receptions can go to 1. And I know our assembly members and Pat Fahey's lobbying to open up more, the restaurants to open up more, but we got to be cautious. I stand behind it. We have to be cautious as we continue to open up. Please check our website to see if you're eligible, and you can also go to the state hotline number at 1-833-697-4829. Our partnership with United Way, 211. Please call if you have any questions. Go through it. They'll help you do it. Go to our website. And we'll continue to get through this. And I'm going to let Dr. Whalen go before I get to you. You got time?
Sure.
We good?
Yep.
Dr. Whalen.
Good morning. So this week we have received another large allocation of Pfizer, 3,510 doses. And we will be working today with the County Executive's Office, with our partners, to firm up a distribution plan for that. But currently we are going to have a large pod at the TU on Thursday. And what will be unusual is that our link will be going live today. So this link will be posted. It is very simple. If you go on our Albany County website, it will be posted later on today. I want to just share, I agree with the county executive that it's important for people to pre-register. If you're going on our website, there are 2 links you can click on. One of them is the pre-registration, which will ask you your information. To sign up for an appointment, you will be given a time. So if you have clicked on a link that did not say what time are you coming, you have not signed up to the clinic. You may be getting outreach to sign up for the clinic, but there is a more direct route for that, which is just to click on the link to sign up, and it will offer you a time, and we hope to see you there. This will be, as I said, a Pfizer clinic, so we would like to, continue to target the younger demographic, including 16 and 20 to up to 24-year-olds. Last week, we were very lucky that we were able to make very last-minute adjustments to clinics that occurred at SUNY Albany to get them Pfizer vaccine on a day that they were scheduled to give J&J. But we know there are more students at our local universities and colleges, and certainly in our high schools, that are currently eligible, but that have not yet been vaccinated. So I would encourage you to come out to the clinic, and we will look forward to announcing additional locations. At this time, when we look at the curve and where we are with cases, we are not seeing the decline that we need to see for us to have a level of comfort with opening up. So it's important to note that we're not there yet. And really, for us to be able to proceed forward in the direction that everybody wants to move, the only strategies towards decreasing cases and increasing immunity are vaccination and continuing with the community mitigation practices. Vaccination is the fastest path to get us back to normal. The Pfizer and Moderna vaccines are now widely available. And we want to see as many people as possible and utilize as many strategies as possible. So not only are we going to be looking at smaller pods, more community-based pods where people live, work, and play, but we'll be looking at providing educational efforts. We know that there's a large amount of people that are sitting on the fence, that are still trying to make that decision, that are saying, I'm just going to wait a little bit longer until I have that level of comfort. And we want to make sure that that is a level of comfort coming from a place of being informed with correct evidence and with science-based evidence. So educational efforts to that end are going to be very important. It's not just a matter anymore of us showing up with vaccine. It is now going to be a big push on education and community engagement, utilizing the strategy of peers that have been vaccinated to help share with communities that they serve their level of comfort. It's not just myself and Dan that you need to hear this from. You need to hear it from many others. You need to hear it from people that you trust that have been vaccinated, that can share their stories with you. We know people do respond to stories. And we know that every time somebody gets vaccinated, not only are they protecting themselves, but they're protecting their family members. So as we urged you at the beginning of the pandemic to mask up, to stay social distance, to stay home, to protect your loved ones, we're now encouraging you to be vaccinated to protect your loved ones. If you are young and healthy and eligible, this is a strategy to help you protect those that you love. And as we see, there is no guarantee that because you are young and healthy, you will have an easy course of COVID if you do contract it. The vaccine is safe and effective and provides great immunity and provides great protection against illness and hospitalization. So we continue to encourage people. I know I've shared that, my children who are all above 16 have been vaccinated, and as a mom, I have that comfort level, and I have myself been vaccinated. So this is something that, again, as we talked about in the beginning of the pandemic, I'm giving the same recommendations to the community that I would give to my loved ones and my family. And really, it is the best strategy to move forward. We look forward to hopefully seeing you on Thursday and in many other locations around the Capital District in the coming days and weeks.
Thank you, Dr. Whalen, as always. And I'm joined today from a colleague who I've known for a while since you've been in office, but Orange County Executive Steve Newhouse, who represents roughly about 380,000 people.
Yep.
And we've had a great partnership, and it was funny because in the beginning, I remember we were talking, it was like 1 a.m, he called my house, my wife like, who the heck, another word she used, but I won't throw her in,
Yep.
who you on the phone with at 1 o'clock in the morning. And it was really good to have that
Oh,
support.
yeah.
Remember, I don't want to say that why we were talking
It was a
about
riot situation, yeah.
and we were talking, and it was good to go back and forth with my counterparts, the county executives across the state of New York, but also county managers, because we're all dealing with something we've never had to deal with before. And Steve, I want to thank you for partnership, not just as a county executive when I was president of NISAC, but as president of County Executives America, getting involved with that on a national level. And really just, at the end of the day, we always say it's not about party affiliation, it's about getting the job done for the people. Regardless, the only thing I do hold against you is that Navy cross I think you have on your lapel, and he is in the Navy, I'm in the Army, but we don't have time for that right now. But I did invite him here to talk about our partnerships, to talk about how they're trying to get the vaccine out too, and again, it's an issue with everyone. Dr. Whalen said it the best about our family and everyone else. We have to educate. People have to buy in. If you want to get out of this, I don't want to talk about the young kid that's in the hospital right now. It's heartbreaking. And to see this happening, what's it going to take? People, please get the vaccine, get your shot, get in line, do it, be part of the solution, not part of the problem. I know, educate yourself, go to the CDC, World Health, go to your local health departments, get it from the experts, talk to your own doctor. Don't get it off the internet, don't get it off of everything that's out there. But please, Steve.
Yeah, I was just thinking, I'm like, why the heck would I call Dan McCoy 1 a.m? But last March in 2020, we had a full-scale riot going on where rioters were shooting at police officers in one of our cities. And the mayor called me. He had called the governor, called the National Guard. I was there with riot police, and thank God I was able to negotiate with the mayor of the city. But I'd called you and said, the thing is hitting the fan. Now I know why I called you. So as Dan said, we have about 380,000. I have about 45,000 people that have tested positive from the beginning. We've had over 800 deaths in our county. We are sandwiched between Albany and New York City. I have about 115 people hospitalized right now. About 10 of them are on ventilators. We track that. Obviously shows how the severity of the situation. We predominantly get Moderna. You guys are getting Pfizer.
Yep.
We are having a hard time right now. We're in the low 30s of percentage of who's been vaccinated. We're having a hard time with people signing up to get vaccinated. So we were banging out in our health department, our pods, point of distribution, about 2,000 to 3,000 people a day. Now we can barely get through 500. Woodbury Commons, which is our biggest outdoor shopping, one of the biggest outdoor shopping destinations in the United States. We did a pod there on Friday. We were hoping to get 500 done. I think we got like 450. I went to one of our big malls on Saturday. We got just shy of 300 done. So that to me are amateur numbers. We're happy we got those folks, but we want to get more. We want to bang those numbers up. In addition to that, our nursing homes, excuse me, I didn't have enough coffee yet. Our nursing homes, less than 50% of the staff have been vaccinated. And that's alarming.
It
so
is.
That's what, going back to what Dr. Whalen's telling, Dan and I both been vaccinated through the military. You got Pfizer,
Yep.
I got Moderna. We're both alive. We both didn't grow a third arm. Didn't help with the Johnson&Johnson last week. We have had an impact on that with people signing up. But like you said, 6 million people got the vaccination, no problem. 6 people had adverse effects. 1, I think, died. That was a total so far. So we need to get people vaccinated. That's really what the crux of it is. I had, Dr. Whalen says about telling numbers. One of my corrections officers died last week. 2 weeks ago, another corrections officer, he got sick. And I believe me, it's not my cough. I grabbed a mask out of my car, which was new, but it was actually dusty. But one of our corrections officers got his father and mother, unfortunately, got sick, and his father died from it.
Yeah.
So we're still finding a ton of senior citizens in these pockets that have not gotten vaccinated. There's definitely a adverse impact from young people to still get the vaccination, which unfortunately, I was happy when my mom and dad got vaccinated, but I was also happy when I got vaccinated as a county executive. We're out and about.
Yeah.
Dan, you're out and about all over the place. We're interacting with people. We don't want to be the person or the cause that helps spread this virus. So we ask people to do their part right now. Right now I'm tracking over 1,000 active cases, so we're higher than you guys. We also have a higher population, but we are not out of the woods here, and we need to still do our part to get out of it.
Absolutely, Steve, and you brought up a good point. We know the guidelines from the governor's office on nursing homes, and we do, unfortunately, you get turnover in nursing homes with CNAs and LPNs and RNs and just regular help. And they either don't want to get vaccinated, or we had a good higher percent in the beginning.
Yeah.
But that's changed with people leaving or moving on and not wanting to come back, and they get new people. And anytime they're positive, we're shut down for 7 days now. It used to be 14, now we're down to 7, I believe. But I get so much feedback from families that want to see their loved ones, that want to get out there, and I'm like, sorry, But again, it's getting people to want to get the vaccine. If you look out what's going out Midwest towards Buffalo and stuff, their numbers are going through the roof. It's scary. We watch it. Steve and I went back and forth, and I watched it go to New York City, Westchester, and then into Putnam, Orange, and we worked together. We gave them PPE in the beginning. Steve gave us. He helped us out. They hit it first, and I'd be like, "All right, Steve, you're like Dr. Whalen and I would always say you're 14 days, behind us." So it was kind of good that we communicated, again, protecting all the residents of New York State, and that's what it's about.
Absolutely.
Steve,
Yep.
I have to thank you for that partnership, and again, a lot of dialogue. We talked a lot the last year.
Yeah, it's been brutal.
It has been. I don't really like it that
And
much.
we're talking about opening events, like you said. It's getting warmer out. We did last year. You came to the biggest event in New York State was in Orange County. We did the air show.
Yep.
12,000 people, but we separated people, and we're planning events right now. I'm booking concerts, major acts. We're going to do another huge air show in Orange County. But what we did is we thought outside the box, and we did like a bingo board. You saw us
Yeah,
firsthand. We set it up. You pull up with your car with your family. You don't go anywhere. You stay by your car and you watch the air show.
Yep.
So there is still things moving forward to get us back to some type of normalcy. But it's going to look a little bit different. And obviously people like Dr. Whalen, my health commissioner, Dr. Gelman, weigh in on what they think is comfortable for us to do.
Absolutely. And it's a good point that you're making. And Legoland's opening.
Legoland, the biggest theme park, biggest Legoland in the world, will be opening in the next few weeks in Orange County. Now
I think my deputy Dan Lynch wants to go there. He said it's for his kids, but I really think it's for him.
Your kids are a little bit older than mine. Mine are still 11 and under, but it'll be at a reduced capacity. But these are good indicators of us heading out into some type of normalcy. But at the same time, there is that Excelsior Pass, which I believe is a good idea, where people get vaccinated and you have your QR code on your phone to get you into large-scale events if you've been vaccinated. I've been traveling for the military. You might be in the near future, too. I just came back. Things are starting to happen again. They have to.
Right.
So the quicker we all get vaccinated and do our part, the quicker we get past that goalpost.
Absolutely. And please, people, do the right thing. You're hearing it from all points of views. We're in this together in New York State. It's just not about the capital region.
Absolutely.
It's about the whole state of New York getting through this together, relying on one another. And that's what I love about New York State, because we are in this together. And I do want to say again, it has nothing to do with party affiliation. It's been a great partnership.
Absolutely.
And I appreciate your leadership.
I appreciate your help. You've been around the block a little bit more than I, and I've called you numerous times. And I obviously enjoy our relationship as friends and colleagues on the phone every day.
Yeah.
And dealing with the same struggles, but getting through them all together.
Absolutely. Again, leaning on one another in a partnership, people. You got to remember, it's partnerships that's going to get us through this. Please go to our albanycounty.com website. Look and see what we need. People go out. You still got to get tested for COVID-19. Please go out and get tested. I know the numbers are really dropping. People aren't going out to get tested anymore. Our mental health support line, please, is always 7 days a week, 8 a.m. to 5 p.m. 518-269-6634. Our 24-hour sexual assault hotline number, as always, 518-447-7716. And again, please continue to do the right thing out there. Wear your mask, cough in your arm, clean your hands 6 feet apart. Stay safe out there.